Hello, everybody. This is Gary. Today is Thursday, October 10th. It's 3:47 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia vlog entry for today. Um, I wanted to talk about something called tobacco abuse disorder and smoking and ways of quitting smoking. Um, I've smoked on and off for the past 20 years. Sometimes I quit. I can actually go several years without a cigarette, and then I've gone back to it and then quit again. Um, but my quitting actually was fairly successful in the sense that I often went 5 or 6 or 7 years without smoking before I took it up again. Um, One time I took up smoking again because my girlfriend had recently died from HIV, AIDS, and complications from HIV and AIDS. And I was sort of depressed, so I started smoking again. And then I quit again after that. But anyways, there's several ways to quit. There's several types of medications you could use. I mean, you could of course try to quit cold turkey, which means you don't necessarily get any counseling. You're not necessarily taking any medicine. You just decide to quit and go through the withdrawal until you're successful in not smoking. That's certainly one way to do it. It's the most difficult way, but you can certainly do it that way. Would be somewhat uncomfortable to say the least to quit cold turkey. Um, but there's two things that I have used in the past to quit smoking. And by the way, my psychiatrist says that when I was smoking, I had something called tobacco abuse disorder. That's actually a psychiatric disorder officially listed in the Diagnostical and Statistical Manual of the American Psychiatric Association. It means that somebody who's smoking is smoking extremely heavily, like a pack or more of cigarettes a day, like I was doing. So tobacco abuse disorder isn't just smoking; it's like smoking becomes your whole life. You spend a lot of money on it. You put a lot of time into smoking cigarettes, and you're just basically smoking one cigarette right after another. What used to be called chain smoking. So that's tobacco abuse disorder. It's more than just smoking occasionally, um, and that's actually a disorder listed in the psychiatric manuals. Um, but anyways, I've quit two ways: either using nicotine replacement products like nicotine gum, nicotine patches, which you put on your arm, and the nicotine is absorbed through the skin. There's other ways of using nicotine. There's a nicotine that you can spray in your nose. There's a nicotine that you can use in lozenges. I mean, there's several different ways to use nicotine replacement products to quit smoking. Um, One thing you got to do is if you decide to use nicotine replacement products, you should plan ahead about quitting a day in the future, and then when you stop smoking, start using the nicotine replacement product, whether it's patch, gum, lozenge, nose spray. Um, and once you quit smoking on a certain quit day that you set up ahead of time as a target, for Pete's sake, do not smoke if you're actually still using nicotine replacement products. You're gonna poison yourself with nicotine poisoning if you smoke at the same time you're using nicotine replacement products. Especially in my case, because I'm such a heavy smoker, when I quit using them, I used both the patch and the chewing gum. Well, it's not really chewing gum, but the nicotine gum at the same time, which means I have a lot of nicotine in my system, even without smoking. And to use the nicotine gum uh, and the nicotine patch and smoking while I'm using them, I've gotten nicotine poison from that. It's not a good feeling to overdose on nicotine. So if you set a quit date, for Pete's sake, don't smoke while you're using nicotine replacement products. And if you do use them and you're successfully able to quit, I would suggest using nicotine replacement products for like 3 or 4 months to make sure that you actually have quit smoking, and it makes it easier to go off the nicotine product eventually, because you're going to have to go off of it. You can't take it forever. So you'll either be successful in quitting smoking after 4 or 5 months, or you're going to go back to smoking after you stop taking nicotine replacement products. It's best if you use nicotine replacement products to get counseling as well as just taking the nicotine products. Um, there's a couple other ways of trying to commit smoking. There's two prescriptions that I'm aware of that are supposed to help you quit smoking. One is called Zyban, which is just a fancy name for an antidepressant, also known. Um, I can't remember, but uh, Zyban is an antidepressant. It was just repackaged because it showed some evidence of helping quit smoking. Wellbutrin was the name of the drug. Wellbutrin and Zyban are actually the same thing. Zyban was just a marketing ploy by the pharmaceutical companies to market it specifically to quit smoking, but you can get Zyban in generic form because it's just an antidepressant called Wellbutrin, and that antidepressant has shown some ability to help a person quit smoking. Not all that great of a chance, but some chance, enough for the FDA to allow Zyban to be sold as a quitting drug. Um, Wellbutrin, of course, does not have any nicotine in it, and if you smoke while you're taking it, you're not going to get nicotine poisoning. But it sort of defeats the purpose of taking Zyban if you're going to smoke while you take it. Again, you should plan ahead, set a quit date after you started the Zyban, and then just stop or gradually go off the cigarettes and stop. Um, Another drug that's used for helping quit smoking is called Chantix. It is another drug that's much more successful in helping people quit smoking. Chantix is a prescription drug, fairly expensive one, um, and you take it for 2 weeks, exactly the same way every day, and then you are allowed to smoke during the first 2 weeks of taking it, and then you're supposed to quit abruptly. You're not supposed to taper off. You're supposed to smoke for 2 weeks while you're on the Zyban, and then, I'm sorry, the Chantix, and then quit abruptly after 2 weeks. I did that, and I actually quit smoking for 5 years that way. Chantix was the most successful way for me to quit smoking. Um, I'm not a doctor. I'm not suggesting you should or shouldn't take these medications. Obviously, ask your doctor or your healthcare professional, if you're a heavy smoker, which drug is best for you. A lot of the time, it's dependent on things that you don't have any control over. Like, what is your insurance company going to pay for? Some won't cover nicotine replacement products because they're available over the counter and they're very expensive. Um, so that's a bit of a problem. Sometimes a person's medical pharmaceutical insurance isn't going to cover nicotine replacement products. Um, and I've had that problem, and I've ended up having to pay for the nicotine gum and patches myself, which are very expensive. The Chantix, however, is a prescription drug. You take it for 2 weeks, and you're allowed to smoke as heavily as you want during that first 2 weeks, and then you stop abruptly, and then you continue to take the Chantix to get rid of, or not get rid of totally, but reduce the craving for cigarettes. There are side effects to Chantix like nightmares, vivid dreams, metallic taste in your mouth when you're eating food. There was some indication that Chantix might increase the rate of suicide or make you suicidal. And if that's true and you're on Chantix, then for Pete's sake, go off the Chantix and ask your doctor for advice because nobody wants you to be suicidal. Um, I personally did not experience feeling suicidal on Chantix. It was basically one of the most successful ways for me to quit smoking. Um, and my insurance did cover it. I had to bend their arm a little bit, but they did pay for it. Um, and it's very expensive drug. I don't believe there's a generic version of Chantix yet. There might be in 2020. I think each drug patent um, for prescription drugs in the United States lasts about 12 years. And then once the patent expires, you can get generic versions of the same drug, which I think is what's going to happen with Chantix in 2020, which is next year. But those are the basic ways of quitting by using prescription medications for quitting. Nicotine replacement products, Chantix, Wellbutrin, also known as Zyban. Um, so ask your doctor what's best. Um, Talk to your healthcare professional, whether that's a doctor or psychiatrist, nurse practitioner, whoever it is that prescribes your medications. And whatever you decide to use to help quit smoking, um, get counseling on top of it, psychological counseling. That makes it more successful for you to quit smoking. But that's all for now. Like, share, subscribe, comment.